Hello everyone. Today we are starting with foundation of exercise modalities. So we will discuss the aims, techniques that we use for patient care, how to approach the patient's problem, and finally how to assess the vital parameters. So these are the foundations for any physiotherapist, because without these our interventions may not be safe or effective. So by the end of this session, I expect you to be able to clearly state the aims of exercise therapy, list and explain different techniques, outline systematic approach to patient care, and accurately measure the vital parameters. This is not just theory, you will be applying this in your clinics and your labs. So the primary aim of exercise therapy is to restore the normal function. This could mean regarding walking ability or recovering any movement after a stroke, okay, post-stroke recovery. We also aim to prevent disability. For example, preventing contractures in bedridden patient, and also we want to improve the strength, endurance and flexibility, and also joint range of motion, which means overall physical qualities, right? And another aim is to promote the functional independence. So think of the patient with osteoarthritis of the knee who is able to climb the stairs without any support. That is where our functional independence works. And also we are intended to prevent secondary complication, as I have mentioned, contractures after post fractures also in the bedridden patient. And finally, the exercise therapy improves the quality of life by making daily activities easier and by reducing the pain. Our techniques are chosen based on the patient needs. So let us see what are the techniques we have in exercise therapy. First one is the passive movement. Here the therapist moves the joint without patient's effort. So this is usually useful for when we deal with the paralysis case and also in case of unconscious patients. Okay. Next one is active movement. Active movement, here the patient performs a movement on their own for maintaining the mobility and also for muscle control. Mobility and muscle control. Next one is resisted exercise. Resisted exercise is either by adding weights or by TheraBand or pulley system. Okay. This is done to strengthen the muscle. Here I have given TheraBand as an example. TheraBand. So this is done to strengthen the muscle. Or it can be of a manual resistance by the therapist. Manual resistance by therapist. So the overall aim of resisted exercise is to improve the strength of the muscle. And our next technique is stretching. Stretching in the sense you are going to improve the flexibility, right? Flexibility, it can be either of a dynamic stretching or static stretching. And next one is strength training. Strength training can be isometric, which means no movement is produced, only tension is produced actually. And then isotonic, where movement against resistance can be given, or it can be isokinetic. Machine controlled speed can be given. Here you can see it is isokinetic type of strength training. And then coming on to the functional training, I told already that this is the real life activities, which means you are helping a stroke patient to sit to stand or ONE patient to climb the stairs. These are all coming under functional training. And then aerobic conditioning. Aerobic conditioning in the sense it can be walking, cycling. Here I have given example of jump rope. So it is for improving the overall health of your heart and your lungs. And then coming on to the neuromuscular re-education. Neuromuscular re-education is especially important for neurological injuries like balance drills and also coordination training. Balance drills and coordination training. Our approach should always be systematic. Okay, when we deal with the subject or patient, our object should always be systematic. So what we are going to do, first we are going to identify the main complaint. What is limiting the patient's life? And then you are going to take history of medical, surgical, social, occupational. And then you are going to examine the physical function. Posture, gait, muscle power, strength and all. And then you are going to identify the impairment. And you are going to set short-term goals and also long-term goals. Fine. And then you are going to select appropriate exercise specified for that particular condition. And finally, you are going to educate the patient and ensure the adherence, because your patient should know why they are doing the exercise so they can cooperate. And then you are going to monitor the progress and adjust the plan as needed. Before starting any exercise, we must assess the overall condition of the patient. So you are going to look at the general appearance, like does the patient look tired, pale or in distress? And then you are going to check the posture and gait, like any obvious deformities or abnormal walking pattern is there. And you are going to test for the musculoskeletal system, like joint mobility, muscle power. And then you are going to check for the neurological status, like you are going to check for tone, reflexes, coordination. And finally, assess the functional capacity. Functional capacity in the sense whether they can dress themselves, whether they are able to climb stairs or carry any object. Those details you are going to assess. Coming on to the measurement of vitals. Okay, it is not just optional, it is a safety requirement that we have to follow. So measurement of your the patient's vital parameter is the most important thing that we have to do. Why we have to measure the vitals? One thing is we have to establish a baseline before starting on with the therapy, so that it is easy for us to monitor the vitals during the exercise. Fine, we have to establish the baseline. And what are all the vitals you are going to assess or you are going to monitor is like heart rate, blood pressure, respiratory rate, temperature and oxygen saturation. And you have to know the normal values. If values are abnormal, modify your exercise or postpone the therapy. So in summary, what we have learned today is exercise therapy has clear aims. Yes, the aims are to restore, maintain and enhance the physical function. So main thing is to enhance the physical function. So we adapt various techniques. We adapt various techniques that are based on patient's need. Okay, and then you have to design a systematic approach for each and individual patient. Systematic approach, and also assessment, especially your vitals. You are going to measure the vital parameter of the subject. So this is for ensuring safety and successful completion of your exercise therapy treatment.